Now, according to the World Health Organization, 12% of the world's population spend more than 10% of their income on health expenses, a situation it describes as unacceptable. Commemorating the World Health Day, which fell on April 7, we take a look at one of the nation's social interventions in the health sector, the National Health Insurance Scheme, and its effectiveness in attaining health for all. Karen Dodo has more on this from Old Fadama.
54-year-old porter and mother of one, Hamzi Abubakar has been living in Accra at Old Fadama for about 6 months now. From Savalugu in the northern region, Hamzi came with her 1-year-old baby to earn a living. Her main aim is to gather money to continue her senior high school education after she dropped out when her mother died.
Because the money is to pay my school fees.
So if you get the money, you go back to school.
If you get you go to school. If you go in the charge, it's no problem to go to school.
So if you go to school, you also take your child to school?
Because it's no talking. If you go, you send to me. But if you get that, you talk small English, is no problem.
So unfortunately, she's been unsuccessful in saving some money to fulfill her dream of becoming a lawyer someday. She now spends all her income on accommodation, food and healthcare.
If you come, they are tired, too much. The legs, the armpits, the body is not good. If you go into sleep, they are going to sleep small. You can get up here. The baby is not sleep free, so it's not good. Maybe you come to market, you go into the small. The money is not good because if you eat the market, you go, you notice. So you take yesterday you make money, you take it to eat. So it's not free, it's not good because my life is changing. Because if you come to the work in the environment, it's not good. Because they are going to school, primary, JSS, they're going to SS, you have stop. Why? So it's not good.
On a good day, she earns as much as 20 cedis and nothing at all when business is slow. Unfortunately, similar young women like Hamzi are in the head porting business, all struggling to make a headway. I wondered why she does not depend on a national health insurance card in her precarious situation. For her, drugs over the counter are cheaper and she prefers to obtain them herself.
When they give, if the body is good, you give me paracetamol shot and the Tida. If you bring me Tida, so you didn't bring it the paracetamol shot.
How much did you spend? How much did you use to buy the medicine?
The paracetamol shot and the Tida is the 7 CD. The thing, the buy the if you 30 CD, the 37 CD. No, my help is alright. So you expire. So you leave it. My sister, you change it. You bring it to me.
But you can change it in Accra. Don't you want to change it in Accra?
I don't know you change it.
I don't know how to change it.
They are sending to the hospital to change it. Before me, you come. If you change it, you bring it to me.
My interaction with many other porters revealed most of them either did not have a valid insurance card or were just not concerned about it or did not know much about the scheme. Like Hamzi, they mostly depend on pharmacies and unlicensed drug vendors who they term market doctors. I decided to visit the nearest health facility in the area to find out more about how residents finance their health. Star 8 Clinic is a 3-room facility comprising of a consultation room, pharmacy and laboratory. Physician assistant John Sibido says within a day they serve about 80 OPD cases and sometimes minor surgery cases.
So this place, we have a lot of challenges. The commonest conditions we normally treat here is malaria, typhoid fever, hepatitis B, sometimes HIV we refer. Then the most dangerous one is the assault cases. people coming in every day with wounds on their faces, their body. So those we can handle, we treat, we suture, sometimes we refer, and sometimes we manage them here, they are fine with discharge.
Assuming I'm here for malaria treatment, what is the average, let's say, cost? How much do you think I will spend?
It depends on the type of malaria. Okay, so what we do is that when you come, we do malaria tests. Sometimes we do RDT, or sometimes we do malaria parasite filming. That one we use the mic to see the type of malaria you have. And then the test is not even the problem. Your physical presentation sometimes will tell the prescriber or the doctor that is complicated malaria. If it's just common malaria, we treat. The cost may be 30 cedi to 40 cedi.
On why most residents in the slum community have neglected the NHIS, John explained that they felt services rendered under the insurance scheme were not quality.
Concerning the National Health Insurance, people don't like it because when they go to hospitals, the doctors end up prescribing the drug for them to go and buy, especially those that are expensive. For example, amoxicillin is a little bit expensive, so the doctors, they will write, go and buy. Then they will come home and come back. So some will say that if I will go to a hospital with insurance and then they will prescribe drugs for me to go and buy, then it's better I go to the pharmacies or the chemical shops and buy my drugs. Okay. And the most serious one is even the pregnant women. You know, in Ghana we are saying that free maternal treatment. If they go to hospital, almost all the antenatal drugs are being prescribed for them to go and buy.
Wow. Although the scheme was established in 2003 to provide equitable access and financial coverage for basic healthcare services, achieving its aim has been difficult as it has been shrouded by challenges including the lack of funds to support the program. The scheme is largely funded by the National Health Insurance Levy, which is currently 2.5% levy on goods and services collected under the value-added tax and 2.5% points of Social Security and National Insurance Trust SNIT contribution. This, the authority says, is woefully inadequate. The authority is currently in need of about 13 billion cedis to provide quality healthcare services. This has translated into poor quality service rendered as most healthcare providers under the scheme are not paid their due claims, with some threatening to withdraw the services. The latest is private health providers in the Upper East region. Dr. Francis Asana is the regional chairman of the Association of Private Healthcare Providers in the Upper East region.
Some private facilities in the region have been unable to pay salaries for the past 3 to 4 months and still counting. This is because private healthcare providers rely solely on reimbursement from the National Insurance Authority to pay salaries and to procure other logistics for their operations. The situation we expect should inform the authority and government to consider making regular monthly payments to facilities. They should make this one a topmost priority to enable us meet our day-to-day operational needs, especially payment of salaries. This will go a long way to ensure a smooth and constant provision of uncompromised quality healthcare services and prevent the frequent labor agitation and strike threats that are faced by managers of these private healthcare providers.
According to the World Health Organization, more than 800 million people, roughly 12% of the world's population, spend more than 10% of their income on health expenses, in most cases to care for sick children or family members. Most Ghanaians are compelled to fall within this bracket as complaints about ineffectiveness of the scheme have deterred some people from enrolling. National Chairman of the Coalition of Non-Governmental Organizations in Health, Dr. Gabriel Benaku, explained that the national health insurance can only be effective if government operates the health insurance scheme as a business.
Monies that you and I insure ourselves, which they are supposed to keep and invest to get more returns so that they can increase quality of care, because of political interference, those monies are delayed in being released. And therefore, service providers who are giving services to government and because of delays, they also pick money from the bank. They are going to charge more interest on the services they offer to Ghana. So the vicious cycle continues. That's why I'm saying that until we amend that part of the law to allow the National Health Insurance to be independent, regulated by a commission, that is the surest way we can have the fully fledged National Health Insurance scheme that will be operated like a business model. Until we have that attitude of operating the National Health Insurance like a business model, we are going to have this crisis every 4 years or every 8 years.
He added that once the authority is able to make returns, much more investments will be made into the types of drugs under the scheme.
Deliberately, we have compromised quality. The person is insured, he is sick, he needs that type. It is not at the facility. Somebody must move to the regional capital to be able to create an opportunity to get the drug for the person to be treated. That's a typical example. Another, the same facility within the region, a child was having an anemic condition. And I had the offer because we have volunteers within the district. So we visited, we tried to, a mystery survey, we tried to find out as if we are part of the family. We tried to find out. At the time they finished the test, the medical assistant, there was no doctor there, even though it's a district hospital. It was supposed to be a doctor, no doctor. The MA supported the process and recommended that we buy such drugs. We went to the district pharmacy, no drug. But when we moved less than 5 minutes, closer by to the facility is a pharmacy shop, and we got the drug there. So the person is insured, but he cannot get those drugs there. We have to get it outside. So people claim that the National Health Insurance is working. Practically, it's not working.
Joseph Sibido of Star Aid Clinic shares the same opinion.
They are doing much, but the problem is the type of drugs that are covered by insurance. Okay, the insurance drugs, sometimes I can say that they are less potent drugs. They are potent, but the most expensive one is not covered by insurance. Or they go to the hospital, you see the insurance drugs list. The drugs are there. Some people are aware, or some can read very well. They even have the list. They go to the hospital, then prescribe, go and buy. The hospital pharmacy will tell you they don't have, go and buy.
Although it is a known fact that to make healthcare truly universal, it requires a shift from designing health systems around diseases and institutions towards health services designed around and for people. The country still seems to be facing challenges with the NHIS as an intervention.
So although government is doing much to improve local drug production, like even wanting to create a farmer park for local drug producers, looks like these efforts in the pharmaceutical industry are not having the trickling down effect for the main beneficiaries. And who are these? The low-income earners like these. While although the World Health Organization has a plan of achieving worldwide health coverage by 2030, Ghana, as a part of the World Health Organization, might not be able to make this possible. Reporting for Joy Business from here in Accra at the Kokomba Market, Karen Dodu.
And that's AM Business today. Karen Dodu bringing us to speed with events with the National Health Insurance. AM Business is on every Wednesday here on the AM Show. It's brought to us courtesy EcoBank is the Pan-African bank. I've got a big birthday dedication today. It's your birthday, Rafiq Salam, my colleague in the Upper West region. It's your birthday, Rafiq Salam, usually reporting for us from Wa. Happy birthday to you, Rafiq Salam. But Rafiq has a wish, and that's based on this story that he did for us. A baby boy born, or a baby born less than a week ago at Natdoli in the Upper West region may not survive much longer unless his parents can mobilize the 12,000 cedis he needs for an emergency operation. And Rafiq Salam says, my birthday wish today is for baby Agnes to survive. So how do we help him achieve this on his birthday? Let's do it. But Rafiq Salam, happy birthday to you. Enjoy your birthday today.